Discussing the topic of suicide can be difficult at the best of times, but when it's with somebody that you know, it's really difficult to know how to approach that conversation when you think that that person may be considering suicide as an option. I just want to share my thoughts with you on how to approach those types of conversations. I always start with the ask twice technique. It's important that we just check in with them and make sure that they're okay. So again, we often just have that throwaway question, how are you today? And there's very much a measured or an automatic response, yeah, I'm okay. So asking twice, it's about pausing, leaning into that conversation and just saying, how are you really doing? And then really listening to that response. It's also about bringing up into that conversation things that you've noticed. You may say, notice that you've not been yourself lately. Is everything okay? Notice that you've not been joining us for lunch like you used to. Is everything okay? It might be that they've said something that you've picked up in conversations that you're concerned about. Again, state that in the conversation. I'm really concerned about what you said in our conversation last week, and I just want to check in to make sure you're okay. Really worried about you. I want to just check in that you're safe. Can we talk about that? It'd be great for me to know that you're okay. When we need to ascertain the level of risk to that individual, there are two different approaches to take. There's a direct approach and there's a softer approach. And depending on your relationship with that individual and how the conversation is flowing, it's easy to make that decision of which approach you would take. The direct approach is to outright ask, are you thinking of suicide? This can be a little bit more daunting to ask, actually, especially if you don't know that person as well. So the softer approach, and it's widely used by suicide first aiders, is to think about something that that person has shared with you. Sometimes when people are overwhelmed, feeling worried, feeling that they're out of options, they're considering suicide. Are you thinking about suicide? These are the two standard approaches to having this type of conversation with somebody. It may be that you don't feel comfortable using the word suicide. It may be that you change that to they're thinking of harming themselves, or they're thinking of hurting themselves, or they're thinking that they're out of options. Anything that you can bring to that conversation to gauge where that person is at and what their thought process is can be really beneficial. And again, it might just save that individual's life.